We are joined today with Mr. Ahmad Abou Tayoun, the clinical molecular geneticist. Thanks a lot, Dr. Ahmad, for joining us today. When we are talking about innovations in technology, what is the most significant impact innovation can have on genomic research in healthcare?
There are actually a few of them, and they're interconnected. Of course, when you talk about individuals' health and patients and medicine, the first thing in the process is identifying the patients with a certain disease, which means to have the technology to identify the genetic mutations or errors that cause that disease. So one of the first technologies that we use a lot that's continuously being evolved is what we call the sequencing technologies that we have just mentioned in the panel. So that's in terms of diagnostics. After this, because we generate a lot of data to interpret and analyze, there is a lot of need for computational analysis and artificial intelligence and machine learning to make sense of the large amount of data that we generate in genomics from the patient, but also their healthcare information. To combine all this information to come up with an accurate diagnosis is very challenging, and technologies in the AI and data analysis are very key. And finally, at the very end, when we identify those patients and know what they have, there's a lot of new technologies that are coming up where we can try to treat. And this has to do with genome editing or gene therapies that has been continuously as well evolving in the field. So I would say in diagnostic sequencing technologies, in data analysis, AI and machine learning, in treatment, gene editing and gene therapies. So these are kind of like...
What are the main barriers, you see especially in the field of genomics when we talk about the technology?
I think the barriers currently, the bottlenecks, as I mentioned, are in data analysis, right? Because it's become easy to sequence the full genome. It used to be hard, but because of the advancements of the technology, now it's easy to sequence a full genome. But one genome generates a lot of data, gigabytes or terabytes of data. So you need a lot of computational resources, data servers, and you need qualified, trained professionals or computational scientists to mine this data and extract clinically relevant information that will help the patient. So I think that's I don't call it as a barrier, but I think it's an opportunity. This is where the field is headed, and we're investing a lot of resources in computational data analysis.
And what future innovations do you anticipate that will completely revolutionize the way we approach genetic diseases today?
Again, it has to do with first identifying the patients, and that I think is becoming more and more accessible. It will become easier to generate genomic data. Actually, one of the predictions of the National Institute of Health in the USA says that by 2030, a whole genome sequence for every individual will become like a CBC test. And that's a very ambitious goal. And I think we're headed in that direction. That will make things a bit more easy for rare disease patients and also for healthy individuals that will have this genomic information for using it for better prevention or whatever. So I think that's one big one. The other one will be a lot of building the stronger pipeline to make treatments. Currently is very slow.
And how do you see the big data and the biobanks evolving in this whole process of new innovation?
I think the biobanks and even disease cohorts in general are building up worldwide. And I think the barrier is going to be, of course, sharing this data across boundaries, across geographies. We share the same human genome, and the only way to understand it is to sample variation across the diverse populations. So my data here will shed specific light on the genome that people in Europe would not have. And the only way we collectively understand the genome is by sharing that data from diverse populations. And data sharing, as we've heard, is a bit of a challenge, requires a lot of regulatory aspects to handle that's beyond the science. And on the science side of things, I think technologies are moving very fast, and governments are getting, and even the private sector getting highly aware of the importance to shift into precision medicine. So there's I think in that sense, in terms of like funding and supporting such projects, regulatory aspects, they're challenging, but I think with that appetite, hopefully we'll be able to solve them.
And just one last thing, what is the kind of impact they will have on the cost for the patient?
I mean, the technologies there's more competition between different companies, and that's driving the cost significantly. The first human genome took $3 billion to sequence in 11 years. Now in Jalila Children's in Dubai, small lab, we do it for less than $1,000 in 2-3 days. That's how much we've progressed in terms of the driving cost, and it's even going lower and lower. But again, just to be accurate, that doesn't mean you get a meaningful genome by that amount of money, because once you generate this big data, the challenge now becomes how you put this into perspective, especially in the clinic. You want to give them clinically relevant information.
Yeah.
And this is where, again, to reinforce the shift in the field towards computational data.
So you're also at the Mohammed bin Zayed University for Research and Training. So how do you feel the educational institutions are preparing the next generation of healthcare professionals to handle the genomic data as well as the innovation?
It's a great question. And I think the only way you can build a lab and have great projects, but the only way you sustain is by building the generation, the ecosystem. And for this, we're fortunate to be part of the BioHealth, because we're in the hospital, we're a medical school. So in my lab, I do diagnostics, but I'm also associate professor of genetics. So in that capacity, I train PhD master students that come to my lab where they train in genomics, and we have a lot of translational clinical implementation projects where PhD, local Emiratis or others in Dubai are actually using this to train, and it's part of their thesis. And I think it's really great because it's closing the loop, right? We're helping the patients, we're advancing science, but we're also training the next generation. And that's the only way all these programs will sustain. At the end of the day, you want to leave a program that continues to thrive, and human resource is a big one to have.
Absolutely. Thank you so much for talking to Middle East today.
Thank you.
Yeah.
Thanks a lot.
Thanks.